Did you know that the key to easing round ligament pain during pregnancy could lie in the often overlooked inguinal canal? In this episode, we dive deep into a critical yet underappreciated area of the body and its profound impact on pregnant clients. Discover how the inguinal canal is essential to the health and comfort of the round ligament, and how restrictions here can contribute to pain, misalignment, and can impact birth. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. Today, I would like to talk to you about the inguinal ligament, the inguinal canal. This area of the body is not an area that I think a lot of people focus in on in their sessions. And as I work more and more with, especially my pregnant clients, it is definitely an area that I want to assess because of one important structure that runs through it. And I'm going to give you all a moment to think about what that one structure might be, especially for pregnancy, for baby's positioning, and for the health of this uterine ligament. It is the round ligament. For the round ligament, it's important to treat top and bottom where it attaches into the labia, its attachment into the fundus, but it also courses through the inguinal canal. And I have found in a couple of my clients that the inguinal ligament attaches from the ASIS to the pubic bone. And in somewhere in that area, the round ligament pierces in from the top of the fundus, pierces towards the top of the inguinal canal, not near the ASIS, but near the groin area of the body. And then it courses through it, and then it pokes out near the pubic bone and then goes down into the labia. Well, I've treated round ligaments, top and bottom, and I've treated as it courses, or I treat it as it enters into and exits from the inguinal canal. But what I found on a couple of patients of mine is that there is actually restricted mobility through that inguinal canal. So what I've been adding to my practice is just taking my fingers and putting them on the inguinal canal and just moving it's more of a lateral motion, or follow the direction of the inguinal ligament and just move it up and down and make sure that all those tissues have good mobility. If it moves easily on one side, it should move easily on the other side. And when I found restricted round ligaments, I'm finding it doesn't move as easily on that side, that it's restricted. So the side that the round ligament is restricted, there's lacking mobility in that inguinal canal. So when we have tension in those inguinal ligaments, then I want you to be thinking about anterior posterior rotations, maybe even in flare out flare of the ilia, and correcting those. You can learn how to correct those, the anterior rotation of the ilia, the side lying assessment for the in flare out flare. And those techniques will correct any tension in that inguinal ligament. And but I also just want you to please be looking at that mobility. We also have a lot of superficial nerves that run through there, so making sure that we have good mobility of this tissue can help those nerves be happier in that area. And there's lymph nodes, and there's lots of juicy stuff that run through those inguinal in that area. And so just make sure that that inguinal tissue has good mobility, especially for the sake of the round ligament. Okay. So I just want you to please make sure that this area from pubic bone to ASIS has good mobility in the direction of the ligament, because that's the direction the round ligament is coursing through that area. And I think if we can improve that mobility of that tissue, then the round ligament is going to be happier. And the person is most likely going to be happier too. So please make sure you check this out with any of your pregnant clients who are complaining of round ligament pain, pain down in that area. Please check this out. Okay. So I know this is a short one today, but thank you so much for listening in, and check out those inguinal ligaments and that tissue and make sure it can move. All right. Thanks, everybody. Take care. Here's to smoother births and faster recoveries. And I will see you all in the next episode. Please share this episode with those colleagues of yours that may benefit from learning this information. All right. Thanks so much, everybody. Take care. Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.